Be rolling, and yes, it's wonderful to see familiar faces. I'm Dr. Linda Bluestein, and I'm here with Lisa Howell. I always call you Australian physiotherapist, but I also just recently found out that you're a Kiwi, so I'm not sure which is more accurate. But I'm super excited to be working with you from all the way around the world and chatting with people today about hypermobility and dance, and answering some of the frequently asked questions that we've received. And so we're going to try to answer as many of those as we possibly can. And whatever we don't get to today, we can try to do a second session if people find that this is helpful. So thank you so much, Lisa, for joining me. It's super exciting to get to see you.
My pleasure. Lovely to see you again. And yes, I am a Kiwi, but I've been living in Australia since 2001 now. So it's getting a little bit of a close call. I think I'll always be a Kiwi in my heart. So you're forgiven if you think I'm Australian. So I pulled together some of the questions, and like I said, this could take 12 hours to go through, but I wanted to make this as practical as humanly possible. I'm going to advise you to try a couple of little things. Obviously, do what you feel comfortable with, but some of them are just little experiments to really try things out on your own body, especially when we're working with bodies. Everyone's a bit different. So some of the things that I find work for me and my clients may not work as well for other people, but really important to test out any theories, especially if the cueing is a little bit different to what you've been told. So I'm just going to share my screen with you. So basically, there are so many people who struggle with this, and a lot of people don't learn the hacks of how to look after their own body until very, very deep in their career. So I wanted to bring forward some of the things that I've found super helpful in working with clients so that you can start to experiment on these yourself. Some of the questions we're going to cover today, if we can rattle through these, would be great. First one is on reduced proprioception and that reduction in our ability to feel where we are in space. A lot of people struggle with that. We're going to look at when things slip out of place, because this is something that often people report, and understanding actually what's going on here is super important. A lot of people struggle with breathlessness when they're dancing. We're going to look at how to avoid overextending your joints in dance. There were a lot of questions around wrists and elbows and arms, and especially in coordination with acro and things like this. So we're going to cover that. We want to look at how we can protect our feet and ankles, especially in point shoes, gaining control of the knees, and ongoing long-term pelvic instability. Now, there's obviously a lot here, but a huge amount. I actually have videos of my hacks or solutions, and so I've got the screenshots and the links that you can go to, and I'll show you how to navigate to those videos afterwards. Super. So first one, reduced proprioception. So many dancers with hypermobility struggle to feel where they are in space because we have so much extra laxity in our tissues. This often results in really poor posture, which can, of course, lead to a lot of other injuries. Also, a lot of people really seek the feeling of a stretch, which means we can often get addicted to static stretching or pushing into areas which are not necessarily as safe as they should be. And one thing that I wanted to have a little chat about, and I wanted Linda to feed in on as well, is just the actual base makeup of our fascial integrity if we've got a hypermobility syndrome. So Linda, maybe you can give a little bit of background on that.
On fascia and how it relates to, yes, so I don't know if everyone is familiar with what fascia is, but if you think of the analogy that's often used is like a sausage casing. And we used to think that fascia was inert, but now we know that fascia has a lot of nerve endings. And not only does it have a lot of nerve endings, but it also has mast cells. So for those that are familiar with mast cell activation syndrome, we know that this is something that is very important and can be a very common comorbid condition with connective tissue disorders or hypermobility disorders. So if people that have mast cell activation syndrome, they have these mast cells are more hyperactive than they are in quote unquote normal people. And maybe you've been hearing more about mast cells lately because of coronavirus. So because these cells are related to more inflammation and can be implicated in people that don't do as well with coronavirus. The interesting thing is, if you have detected mast cell activation syndrome and are being treated for that, you actually might do better if you get infected with coronavirus or SARS-CoV-2, which is that's actually the virus that causes COVID, which is the disease. So that's kind of an important difference with that. Sorry to digress into that briefly, but anyway, so fascia is super, super important. So, and I really appreciated so much when I attended your workshop, how much, you spent on explaining what fascia does and why stretching, static stretching is not the right thing to do, and the important role that fascia plays, because it's a newer concept, I think.
Yeah, 100%. And actually understanding how fascia relates to everything in our bodies. So if we're thinking of it as this spider web that, yes, is around our muscles, but it's through it, it's connecting everything to everything and provides a huge amount of feedback as to where we are in space. But how I explain it often to my kids who are hypermobile, the kids who are fantastic jumpers, who are really kind of tightly strung and bound together, their fascial network is often quite rigid and quite resilient. They can bounce off it, they can spring, they don't get as tired. If we're a little bit more hypermobile, imagine that it's got a bit more space in it. It doesn't hold its shape as much, it can deform much more easily. Often we can get much greater mobility, but there's not a lot holding it together. And this especially comes into play around the joints. So if we've got a very simplified joint here with our capsule on the outside, if you've got a regular joint, if that joint is moved slightly and the ligaments and the fascia around it is stretched, you get feedback that you can return it to a neutral position. If you've got really floppy joints, you can take it through a huge range before your brain really recognizes that anything has happened. This is why hypermobile people will often go over on their ankle way more frequently, because we'll go way out of alignment before there's any stimulation to recover. So if we do have hypermobile joints, we'll tend to slop around a little bit. I find this especially in the hip, because the hip joint is like so. If it's swimming around, we tend to like to find a hard, what I call end point, something that we can really sit into that feels stable. If we have the hip centralized, it often feels a little bit floaty. So people don't really like hanging out there. It feels a little unsafe. This is why we'll tend to sit into one hip, sit into the other hip, or shunt the hips forward in order to feel a little bit more stable, especially when we're tired. So something really important to keep in mind when we're looking at our posture. The thing that I do enormously to help with improving proprioception is using dynamic tape. Now, dynamic tape is made in Norfolk Island, of all places, by an Australian physio. It's not kinesio tape. So K-tape, rock tape, kinesio tape are all the same. Dynamic tape is a little bit different, and it has a stretch sideways and lengthways and this way and this way. Now, I have no financial kickback from dynamic tape. We really need to set that up, because I recommend it all the time. It is brilliant for dancers and it is brilliant for hypermobile people. The thing that I love is that when you apply it in certain ways, it gives you the feedback when you're approaching the end. It doesn't stop you from going there, but you can feel it tighten up, so you can get a little bit of a reminder, oh, I'm reaching the end, I need to recover myself. One of the techniques that I use enormously for this is taping over the back of the knee. This is super helpful in learning how to master control of the knees, but also of the pelvis. Now, this video is now freely up on YouTube. I'm just going to play the little starting bit for you, so you can watch the relationship between the knees and the back. Millie is very hypermobile in here and demonstrates it perfectly. Now, the last taping I'm going to suggest trying if you're having issues with the back is not actually for the back itself, but for the knees. if we tend to have very hyperextended knees, this can throw a lot of load into the back. So if Millie turns and faces sideways, if she lets her hyperextension go, she'll hinge straight into the low back and can get a lot of discomfort from being in this position. So we want to bring out of that hyperextension to allow her to find the perfect position of the pelvis. Now, we looked at this in the level 1 course, lying down on the ground. You can do a substitute version in standing. So if you just keep the pelvis nice and vertical, cock this leg by lifting up onto demi-point. Yeah. You can do it on yourself, sitting on a chair, I find is the easiest one to do yourself. Starting below the knee with a nice anchor. Again, pulling down and back, stretching up and across the back of the knee. And wrapping around that inner thigh. Stabilizing down and back, crossing across the back of the knee. I like doing it in about that 30 degrees of flexion. Straighten that neck so that when you come into standing, you'll feel a little bit of buoyancy when you go into hyperextending. You can still do it, but you're going to get that gentle kind of tugging feeling on the skin, especially when it's done on skin rather than through your yoga pants. But it's a really nice way to give awareness of an optimal placement of the knee so that we can start building the stability.
But that is the kind of technique that I do a lot of. I also do a lot of work around the shoulders, around the abdomen, to actually help reposition us while we find the strength to stay there. So in terms of the hacks for improving proprioception, even a strip of tape along the inside of the elbow can help if you're really struggling with keeping that elbow from hyperextending when you're in class. Another one that I do is coming from the front of the pelvis up to the thoracic spine. And this is really good if you tend to shunt the hips forward. It really helps give a reminder during the day, and you can use this in class under a leotard. Nobody can even see it's there, but really nice to help give some awareness of where the rib cage should be in relationship to the pelvis. In regards to bones slipping out of place, this is something I got a lot in clinic. People would come and say, yeah, this rib slips out and my chiro puts it back in. And I just wanted to get clear that this is anatomically usually impossible, especially around the hip. If you have dislocated your hip, you have usually fractured your pelvis. So it's not something that you can pop out and pop back in. If you feel a bit of a snap or a click, it may be a tendon flicking over something else, but it may also be what I call a joint position fault. And this is where we can have a very, very tiny displacement of where the joint should sit. So if you imagine that you've got a joint that normally rocks and rolls like this, if it's very slightly shifted, it may not get its nice gliding movement that it needs to work. If you look at the ribs here, they are really tightly bound by all of this ligamentous structure. Yes, when we're hypermobile, it's a bit more floppy than it is in other people, but it's very hard for a rib to actually pop out and then pop back in again. So the biggest, most important thing with this is understanding this so that your brain doesn't go crazy. When I was young and things like this used to happen, I used to visualize that bone being out of place, and that visual makes things 10 times worse than they need to be. So if you feel like something has popped out of place, first thing is breathe. Know that it is very unlikely that you have dislocated that. Shoulders, yes, you can dislocate, so we may need to be a little bit more cautious around shoulders. It's almost impossible for it to slip, but it's more likely to be a little spasm of all the muscles around that area going, I am scared, I don't want you to move. So the first thing I do is recommend getting yourself lying or sitting in a supported position. I have a video on YouTube of lying on your back with a towel underneath the low back, legs on a chair, towel for the sacrum. You want to be lying where your pillows and supports are holding you in place so that those little scared muscles can actually chill out and relax. You can use heat if needed, because often that little reflex spasm will make things tighten up. Then breathe.
especially around the rib cage. You want to focus on the joints actually having a little bit of a glide with your breath. So where your ribs wrap around as you breathe, if you imagine a really tiny rolling movement as you breathe in and as you breathe out to try and restore that natural glide, can help immensely. You can try gentle contract relax in an area to create a bit more contrast, and that can help break that cycle of chronic contraction. Once the initial spasm has settled, then you can start building in some really micro movements. And I have 3 versions of my tucks and tilts exercise. I've uploaded all of those to YouTube now. There's the original tucks and tilts sequence. There's a sacral version and a micro version for your deep, deep, deep back muscles. Now, in the beginning, if I had a spasm in my back when it was excessively hypermobile and I didn't know much about it, it would take weeks to recover. Now, haven't actually had one in ages, but if when I was treating a lot, if I had run into a yoga class, hadn't done any prep and started to go on to some deeper movements, occasionally my back would go, I'm not ready for this. It would take me about 5 minutes to get it settled down, reprogrammed, and be able to join back into the class. So taking it from a 4 to 6 week rehab program down to 5 minutes, just by understanding exactly what was going on and not letting myself freak out, has been hugely empowering. So in the beginning, it'll take you a while to master. Once you know how to fire these deep little stabilizers, it can be such a godsend, especially when you're in an acute state. So I really encourage you to work your way through those. Start off with the original tucks and tilts. Once you've mastered that, then you'll have the awareness to be able to do the next 2. Breathlessness. When it comes to dancing, again, I have another video on this where we're talking about the relationship between the pelvic floor and the diaphragm and the muscles that wrap around. A lot of dancers, and especially mobile ones, struggle to keep breathing because they're locking on with their global abdominals to try and hold themselves together so they can't actually breathe when they're dancing. So I just wanted to go through a little 60 breathing exercise that I use for this. You'll see in the picture here, we have our pelvic floor, we have our diaphragm, we have our transversus abdominis, which is our wrappy roundy one, and our deep little back muscles. That's our deep inner core unit. And ideally, as your diaphragm comes down, your pelvic floor will relax. As your diaphragm rises up and air comes out, your pelvic floor will collect. They should have this really nice relationship with each other. You can do this if you have a stable spine and deep core. However, a lot of dancers have learned to brace themselves and they lock their pelvic floor, they grip on with their big outer abdominal muscles, and they lock their diaphragm in order to keep the trunk still. A huge amount of the beauty, if you see somebody amazing dancing, is in the fluidity where they're fluid but in control. You've all seen young hypermobile ones who are floppy all over the place, and we've also all seen people who are attempting to stabilize too much and they look a little bit wooden. We're aiming for this beautiful dynamic control, and that's what we need in order to be able to breathe whilst we're dancing. So a huge amount of it comes down to deep spinal control. I just want to run quickly through the 60 exercise for you, and you can do it in sitting. So if you take your one hand and place it on the front where your diaphragm is. So if you feel where your ribs come up, placing your hand across the front. The other hand, if it's comfortable, around on the back, around the same level. If this hurts your shoulder in any way, try the other side. If it's too uncomfortable, you can actually just shuffle back in the chair and use the feedback of the chair as the back tactile sensation. Then you want to ideally close your eyes and focus on what you feel of how much movement comes to the front compared to the back. A lot of people will be 100% to the front, nothing to the back. Some may be 90-10, some may be 80-20. We're looking to have around 60% coming to the front with about 40% to the back. So if you can't feel anything coming to the back, you're probably not having a nice effective movement of your rib cage. You should be able to feel the rib cage expand a little at the back when you breathe in and then collect in again. Some people, just by thinking about it, can create that expansion through the back. If you find that really hard, Maybe try it lying so you're not having to use some postural stabilizers, but also you may need to do some very gentle massage techniques or some nice mobilizers of the rib cage to help get it a little bit more pliable to allow that expansion. A lot of people who are hypermobile have learned to brace and really lock down their thoracic in order to stay upright, but that can really interfere with our breathing. So really want to establish this. Next, take your hands, place them right to the sides. So up quite high, not down on your waist. And again, close your eyes and focus on feeling the symmetry of your breath. Does it expand to the right and not much to the left? Does it go right, left? Or do they expand nice and easily, both sides? We want to make sure that this is nice and balanced. If you have a scoliosis, you'll tend to feel it more on one side. We want to focus on mobilizing the closed side to allow that to expand a lot more with our breath. Then we're going to go up and down. So you want to place one hand on your neck muscles and the palm on your breastbone. And just have a little bit of a move of your neck. These neck muscles at the front, they're good for moving, but they're not that great for breathing. You're allowed to use them if you've just been sprinting, you've just done a coda, you've just climbed Mount Everest, then you will get a bit more apical breathing up here. But in regular breathing, we want them to be quite soft. Place your other hand below your belly button. And so I like putting my thumb in my belly button and resting the hand below. Close your eyes. And just with your normal breathing, see which hand feels more movement. Some people will be all up into the chest. Some people have learned how to release and really let the lower hand expand. If you're a teacher and you're working with young ones, keep an eye out for what I call paradoxical breathing. Sometimes when they breathe in, they suck in. Yeah? When you breathe in, your lower abdomen should relax slightly. Be careful of using the cue breathe into your belly, because your super smart ones will go, well, there's no air in your intestines. What are you talking about? What's happening though is that as the diaphragm comes down to allow air into your lungs, it will distend your abdominal contents. When you breathe out and your diaphragm comes back up, it allows your abdominal contents to come back in. So there will be a little bit of an expansion as you breathe in and a collection when you come out, but just be careful of your terminology so that you don't switch off your super smart ones. Then take your thumb tips together, fingertips together, place them below your tummy button. Yeah. You want to take a very deep breath in, thinking of expanding forward, back, side to side, a little bit up and mostly down. Then as you breathe out, do a shh sound for as long as you can. This really helps get a collection of all of the deepest stabilizing muscles. You get a little bit of your pelvic floor coming in, you get those deep back muscles coming in, really helps get that low tummy. I usually do that about 4 or 5 times, feeling the expansion with the in and the shh collecting with the out. It's very much in a spherical expansion and collection rather than a pull your belly button to the spine. That's a really common cue, but if you pull your belly button to your spine, you'll often end up going into a tuck and flattening your back and disabling all those baby back muscles, which are super important in hypermobile people. One of my very precocious 9-year-old boys said, oh, it's like you take Jupiter and make it Pluto. I said, that is exactly what it feels like, letting it expand and then letting it collect in the center. I really encourage you to play with that, lying on the ground, sitting, standing, lying on your side, in lots of different positions. The more you can get that connection, the better. You can do the shush as a kind of resistance training one, but then it's really nice to just rest your hands on with normal breathing and feel a mini expand and collect and expand and collect. Your core should be working at that low grade level all the time. So you can actually be doing your core while you're sitting here watching this core, of getting those deep little ones firing. The more dynamic and spontaneous they are, the less we need to think about our core, and the more it's going to help stabilize us dynamically, which is essential when our ligaments aren't as strong as some other people's. Super. If you really struggle with this, now this is especially if you have had multiple pregnancies, you've had abdominal surgery, you've had a lot of abdominal pain, both natural deliveries and cesareans. If you're hypermobile, you can often have not a great setup for activating through this area. So I have two taping techniques. They're in one video on YouTube. One I take, you can see just around through the front. It's basically connecting across the front of the pelvis. This is really helpful. I even have some students who would use it when they had period pain to just help keep a little bit more connection to the front, because when they got pain from their period, their back would become more unstable. If you're needing a bit more support, there's a big cross sling up through the front. And I've had this with a lot of dance teachers who've had a lot of back pain, a lot of abdominal pain, several pregnancies, maybe a gallbladder removed, something like this. It really helps give a little bit of support and connection to the front, helps release a lot of the back pain, and it puts them in a position where they can actually learn to do the stabilizing exercises. A lot of people are given stabilizing exercises when they're still in pain. That actually doesn't work. The pain will inhibit exactly the muscles that we need to stabilize. So I really encourage you, if you're having issues connecting to this area, try the taping techniques and see if that gives you a little window to make life easier. Then there are a lot of questions about how do you stop overextending your joints in dance. I use taping techniques a lot for this because it's hard enough when you're thinking about it, let alone when you're busting out a routine. So we'll usually pick one or two of their worst areas, whether it's elbows, knees, their back, and create strips with the dynamic tape just to increase their awareness. This then allows us to build good movement patterns, so over time they don't need the tape as much. Super important to remember that just because it's not sore doesn't mean it's not doing damage. A lot of young ones and a lot of parents of young ones go, oh, well, it's fine. She doesn't feel that there's anything wrong. Surely it's fine for her to do. I usually say, look, if a child eats one chocolate bar, are they going to get sick or put on stacks of weight? No, not at all. What if they eat 25 a day for the next 10 years? It's a cumulative effect. So and parents get that straight away. They go, well, a treat every now and then is okay, but if they're doing it all the time, it's not. And if you have a joint that's already hypermobile and you're taking it to its extreme 25, 50 times a day, it's going to get more and more and more lax over time. Somebody else had asked whether it was possible for things to get more mobile. Yes, it is, if you're constantly loading those tissues. Fascia will do exactly what you tell it to do. So if you tell it that you want it to get longer, it'll get longer and more lax. If you train it, you can make it stronger, which is the side of the fascial training that I don't think there's been enough looking into, which is something that I am very passionate about and doing a lot of exploration about. How can you tell if a joint is being overstretched? It's one of the wonderful cartoons from my dad for a little book we did on it. A real key thing to look for in class is any folds. So especially if they're going into a kind of back bend, if you can see a definite fold in the back, usually not a great look. We want to get even range through each of the joints. There's two different things going on here that you may see. In this larger image, she's hyperextending her elbows and hyperextending her shoulder, whereas this one doesn't have the range in her elbows or shoulder, so she's taking it into her back. Just because you're hypermobile doesn't mean you're hypermobile everywhere. And this setup is something that I see a lot where students are doing acrobatics when they don't have the appropriate overhead range. And that's actually what's driving the hypermobility in their low back. So just keep an eye out for each one of those. Also made you a little list of what you should not feel when you're stretching. You should never feel pain in the joint. If you are, it's likely that you're stretching the joint, which is never a great idea. You shouldn't feel like the joint needs to crack. And often those of us who are a bit hypermobile like to crack and pop our bits all the time. I used to personally crack my back at least 6 times a day, and it became more and more and more unstable. So learning how to reduce that down over time by building up stability is amazing. You can't just go cold turkey, but we need to aim to reduce it over time. You should never feel a strong line of pull. So if they're stretching their hamstrings and they feel a big line of pull down into their calf, that's likely a nerve, not actually any of the muscles that you're trying to stretch. You also don't want to feel pain in another area other than the muscle that you're trying to work on. You want to feel it in the meaty part of the muscle that you're working on if you're doing any kind of stretching. If you're stretching your hamstrings and you're feeling it in your calves, you're not getting an appropriate hamstring stretch. You also shouldn't feel pain on the opposite side of the joint. So if they're going into second splits, if they're feeling pinching in the back of the hip, that's the joint getting compressed, not getting any opening through the inner thighs. So really important to say, what are you feeling? Where are you feeling it? To make sure that we're not actually putting them into compromising positions. You also don't want to have pain on the compressing side of the joint. So if you're going into a forward bend, you don't want to feel pain in the front of the hips. If they're feeling pain there, there's inflamed tissue that's being squashed. If it gets more squashed, it's going to get more inflamed, take up more space, get even more sore. So really important that we don't have any pain on the closing side when we're trying to go into a stretch. And there shouldn't be any pain the next day. And this is something that I find hilarious when I run the level 2 teacher training course. We have an advanced one on flexibility. And a lot of people have great improvements in the first day, and then they come in the second day and say, oh my goodness, I expected to be sore today because I got so flexy yesterday, but I feel fine. And that's what happens when you deal with flexibility with respect to the tissues and you really carefully choose which techniques you do to gain more range rather than just trying to pull it longer. We really need to get away from that approach to flexibility. Arms and wrists. This was a huge thing that came up on a lot of different platforms. Especially now, a lot of people are doing more yoga, a lot of people are doing more acro, a lot more partnering. So wrists and elbows and shoulders are taking a lot of load. First thing I'm going to say with this is understanding the shoulder and its place in operating the arm is really important. So we're going to have a quick little look at that. The shoulder must be stable on the chest wall before we can do anything with the elbow or wrist, because it all tracks back to the shoulder. Having a good nerve supply to the muscles that control the shoulder are also really important. So one of the classical cues of really dropping the shoulder, keeping your shoulders down and back, can actually irritate and strain the nerve, your long thoracic nerve, that actually supplies one of the muscles that is essential for holding your shoulder in place. If you've been told for however long you've been dancing to keep those shoulders down and back, that may actually be contributing to a lot of the winging that's happening at the back. We need to learn how to carefully place our shoulder so that that nerve is not on strain. Once the nerve is sliding, the muscles ping back almost instantly. It's really beautiful to see. And then when we're building on control, we have to build it up in layers rather than doing really intense resisted exercises, which is what people tend to jump into. If you think of the shoulder blade, it's like the base of a crane. So if that crane was set on a bed of jelly, you wouldn't be very effective in lifting anything with the tip of the crane. So having the shoulder blade nice and stable on the chest wall is very important. However, it can't be too stable. A lot of people think of locking it in place, but in order for your arm to go above your head, your shoulder blade has to rotate. So it has to be dynamically stable. This is really, really tricky when you're doing lots of complex movements, especially if you're spinning around on your hand. Kind of challenging. So need some very specific training. One of the muscles that's super important in this is Serratus Anterior, and this is this zigzaggy muscle that you see on a lot of guys if they've got their shirt off and their hands over their head. You'll see a little zigzag. Ideal if you're watching a professional male dancer doing a pas de deux, you can often see it. One of the tricks I get to get this activated is part of our thoracic mobilizer sequence. It's the Spartacus version. So you want to take your pinky finger, sweep it down and up and across the body. And the rotation here really helps gather your shoulder blade in underneath. I then take the arm up and over and out into second to help get that facilitation of control. It's a really nice way to teach port de bras. We have to get that a little bit fired up, especially if they've been sitting at school, they've been on their computer, doing a few of these sweeps to really get it fired up is nice to actually get the feeling of the shoulder blade wrapping in underneath the armpit. Pinching them down and back is not a great cue to get it working. We want to smile between our shoulder blades, get them nice and wide on the chest wall, and that provides a much nicer base. I did flamenco as well as ballet when I was young, and learning how to do castanet rhythms with a really broad back is absolutely perfect for shoulder control. Just wanted to show you these two little videos that I discovered whilst I was looking for something else. This is a client, and this is in one session. So we had a look at her shoulder. The first video, her shoulder wings off the back terribly. Then she's in a different top because we replaced it with a halternet top to tape it. And then I taught her how to control it. She's got the awareness of the taping. The taping is skin colored, so it's a little bit tricky to see there. And you'll see just how much she's learned how to control it by using her mind. We did a little bit of neck treatment to make sure that the nerve was supplying it was working well, but just watch her right shoulder. See, as she lifts up, it pops off the back a bit. Kind of gathers itself there. Yeah. Watch it on the way down.
And then come back down.
Yeah. So as she comes down, it kind of really pops off the back. She lifts up to the side.
And then lift them up out to the side like a bird.
And she was getting a lot of arm pain
up and go all the way
down into the top.
Good. And then come back down.
So not working very well. Then this second one, again, same day, just with a little bit of cueing, and she's walking her fingers up the wall.
So crawl it up.
Using her other hand to trace where that shoulder blade is in place.
Good. So you just want to use just enough pressure through your fingers so that your shoulder blade doesn't wing.
Yeah, stays beautifully stable.
Good work.
So the feedback from the tape and her fingers, that's finger light pressure on the wall. She's not using the wall to support, but it's a brilliant training exercise for getting that shoulder blade under control. The taping technique for that is also on the YouTube channel. There we go. There we go. Then once we've got a little bit of control, we can start challenging it in 4-point. So a lot of hypermobile people hang out like this. So we're going to just have a little bit of a practice of getting our elbows in control. Most of this comes from the shoulder. So if you can place your hands on the table, if you're a bit hypermobile, your elbows will usually swing around to the front. So they'll pop into that position. What we want to do is make sure that these, where you get your blood taken from, those veins, is facing each other. So just have a little play with how much your elbows rotate to the front and bringing them around together. Some of us have a heap of range through there, which is very challenging to control. A lot of the time people are told to bend their elbows in this position. I actually don't like doing the micro bend. I find if you get the rotation control from the top, that really helps unstick it from that hugely hypermobile position. When it comes to the hands, this is something really, really interesting. A lot of acrobats are taught to make little spider hands like this. I tend to make a little doming exercise instead. Now this is really interesting, and I want you to see what this feels like on you. If you place your hands down and lean onto them with not much effort and come forward, if you're a little bit hypermobile, you'll usually feel some compression through the top of your wrist. That is not great when moving into a handstand or knee loaded position. If you come back off it and claw your fingers and come on, it will feel usually a bit better. Then if you come back off it and make a little doming of your hand and come on it, it'll usually feel better again. So I will explain this with some pictures of the anatomy in just a moment, but it's really important to make sure that we have some activity to tighten up the tendons that wrap under here. If we let that sink, we're pretty much bone on bone. People with tight ligaments don't ever feel that, but when you're super floppy, going into that position, it takes quite a bit of conscious effort. I usually do it normal hands and knees first. Then we'll start taking off single arms, single legs, then moving into a hover, as she is in the bottom left. I also spend a huge amount of time working on crawling. I have an entire post on the Ballet Blog about the importance of crawling. Often hypermobile babies don't crawl very much. They learn to stand up and strut themselves and usually fall into running before they do much else. So really important that we are focusing on reconnecting our big cross sling through the front that gets developed when we crawl. Loads of information in there. If you don't want to be down on your knees, there is also an adult crawling variation, which we do in standing. We then want to make sure that the shoulder blade is not just stable in one place, but it can cope with movement. So making sure that we can travel forward and back from that 4-point position. And then I also do a lot of practice of moving from 4-point into down dog, especially if they're participating in any kind of yoga. In the intro image, one of the girls was in down dog with hugely hypermobile elbows. That's not a great position to hang out in. But if you're doing down dog well, it can be very strengthening for a hypermobile body. 2 areas that I really focus on is making sure that they're sticking their bottom out a little bit to activate the tiny little baby back muscles here. A lot of hypermobile dancers will actually have a flexed lower back and an extended upper back. We want to reverse that. We want to have a slightly extended lower back and slightly rounded out through the upper back to help build the stability. So something very important to keep an eye on from the side. When it comes to that wrist control, the reason we want to use the activity through the hand and the wrist is to use all of the tendons that pass here to actually brace the underside of the joint to stop these couple of little bones from slipping down and creating too much compression through the back of the wrist. You have some within your hand, your intrinsics, exactly like in your foot, and you have some finger flexors that where the muscle is up here and the tendons all the way down into the fingers. Madison asked for me to go through again why I don't necessarily like the clawing. You can claw without actually bracing the deepest stabilizers here. I like getting the doming as well as a slight feeling of pressure down through the fingertips, so you've got all the muscles working. If you just claw, you can actually still sink into that area. So really building their strength and control, what we call either a gecko or an octopus sucky thing, usually sometimes trying to get that kind of feeling on the floor, I find helps protect their wrists even more than just the flexed fingers. Flexed fingers will be better than nothing, but the gecko hands I find is more effective than both. Then, oh, we're going great guns. Feet and ankles. Often when kids have super hypermobile feet, they look wonderful when they're in demi points, but then when they go on point, they don't look that great. This is often because there's a fear of going too far over. First of all, we need to make sure that they have passed a very rigorous pre-point assessment. And I am even more tough on the kids who are amazing. As we mentioned in the other Hypermobility webinar that I did with Linda, I'm super tough on the kids who are going to be doing it long term, because those feet are going to be in shoes for the next 20, 30 years. We need to make sure they've got everything right. If they have super hypermobile ankles, I again use either dynamic or sometimes even rigid tape to stop them from going too far. So while they build the strength and control, I actually do a cross tape across the front of the ankle so that they can't push over. If they're pushing over too far, they'll tend to get compression in the back and get a lot of posterior impingement in the back. They'll also feel like they want to pull back off point, so they may retract their ankle as well. So it's really important that we allow them to feel what a really nicely placed foot feels like as they build the strength to control it themselves. And an interesting thing that I've noticed is a lot of students do heaps of work for their pre-point assessment. They get really strong, they can work their toes, everything's looking wonderful. Then once they get their shoes, they stop doing all their pre-point exercises. It is super important for every single dancer, but especially the hypermobile ones, to continue with a comprehensive and progressive foot strengthening protocol. So we need to make sure that they're keeping on it at any time, that you could spring a pre-point assessment on them at any time. and they should pass. I have actually taken higher level kids off because they haven't passed their pre-point assessment when they're 15 and they got their shoes when they were 12. Say, honey, you're actually not as strong as you were when you were 12, when we were focusing on this all the time because you've been doing all this other stuff. You're not actually allowed to do them in class again until you can pass your pre-point assessment. And the look of terror on their face, it doesn't take them long to get it back up, but it's really important at any stage during your career, you should be able to pass that pre-point assessment. If my average 11-year-olds can do it, you should be able to do it too. And I'm pretty nasty on them. The supporting the foot, we have the taping for it. Again, the whole taping technique is on YouTube. I also have a slightly different way of placing elastics on point shoes in hypermobile people. So often hypermobile people, the point shoe will tend to break down quite low and they'll sink in the shoe. That can lead to a lot of stress fractures. I really like breaking the shoe in just in front of the heel so that it really snugs in and gives them a really lift up out of their shoe. With this, I also like their ribbon coming down a little bit more forward than traditionally we'd have it. So you can see in this picture here, the ribbon is actually going down to that point where the heel break is. This really helps suck the sole of the shoe onto the foot so it gives them more feedback. However, if the ribbon is moved forward, then sometimes the heel can pop off. Instead of doing a loop of elastic to keep it on, I do a cross, and this allows the cross to actually sit right over this talus bone here rather than wrapping around the ankle. I find it's less constricting for their ankle tendons, and it also gives them a bit of feedback through the front when they're coming up onto point. So I have a cross of elastic that goes from inside the ribbon to the opposite side of the heel, inside the ribbon to the opposite side of the heel. And this really helps snug that shoe onto the hypermobile foot. When you tie the ribbons on, this ribbon covers this bit of elastic anyway. It doesn't look any different from the outside as a normal loop of elastic. So there's no aesthetic detriment. And I find for those with really hypermobile feet, this can be fantastic in really helping them feel connected to their shoe so that it's an extension of them rather than feeling it slopping around on them all the time. Gaining control of the knees was another huge one. I tend to use the hyperextension taping a lot. And then I have an exercise as well that's on YouTube of learning how to go into the extension, straightening the knee, and then hovering the heel just 1 centimeter off the ground. This really helps get the feeling of building strength instead of just saying soften your knee slightly. A softened knee isn't actually very strong and it can be quite unstable. So we need them to get that feeling of pulling up but not pulling back. I do a lot of work sitting down on the ground. Then I do a lot of work either standing with the back against the wall or facing the bar with using a plie, focusing on really controlling the turnout muscles as we straighten. I like to give everyone a little bit of a play with the feeling of this relationship of your turnout to your hyperextension. So if you pop into standing, if you stand in parallel and you let your knees hyperextend, they will usually bow out a little bit. And a lot of people say, oh, I have bow legs. However, if you wrap with your turnout muscles, you can usually bring them straight together. So if you're sinking into your hyperextension, your thigh bones will turn in, your shin bones will turn in, and your feet will pronate or roll in. If you connect your turnout muscles, you can bring your knees around to the front, your foot comes into a good position, and it's actually much harder to hyperextend your knees. So just have a little play with really pulling up with the turnout muscles engaged versus pulling up when your turnout muscles are not working. It's a totally different experience in the knees. We need to start any control of the legs from these deep turnout muscles, just as we do any control of the elbow from the shoulder. So we really need to make sure that the joint that connects to your body is under control first. And then the last one, oh my goodness, timing is great, was about ongoing long-term pelvic instability. And this I get when I run my teacher training workshops all the time. There are numerous teachers who have had a mobile body and done a wonderful thing with their dancing when they're young. After they've had kids trying to run a business, balancing home and studio, teaching, they're really struggling with actually keeping their pelvis under control. This can happen whether you've had a natural delivery or a cesarean, because the relaxin, the hormones that you get through your pregnancy, you get the same ones whether or not you have a natural delivery or not. And especially if you've had a cesarean, having abdominal surgery inhibits the whole front anyway. So really important that we learn how to control the pelvis. It's often really frustrating, and a lot of them say, look, I've been going to Pilates and I'm doing all of these exercises, but it just doesn't seem to get any better. The reason behind this, I feel, is that a lot of people try to do exercises when they're in pain rather than finding a pain relieving technique to calm that before they actually start cueing the muscles over the top. If you're in pain, your deep stabilizers switch off. And this is super important to understand. I have 4 different pelvic taping techniques. I've just put all of these up on YouTube. It takes a little while to find out which one works for you, but once you find it, it's like heaven because it takes the load, it reduces that strain so you can actually feel a little bit more relaxed, but then you can also have the space to learn how to stabilize. You need to offload those sore tissues before they're going to respond to any training. There is one that is more about compressing the sacrum. This, for some people, is absolute relief. Some people, it will make them worse if it's already too compressed. So with any of these, as soon as the tape is on, you should go, oh, that's nice. If I don't know about this, it's probably not the right one for you. I have another one that really helps support the deep little back muscles and the big cross-sling through the back, which is wonderful for some. If you don't like the sacral compression at the back, often you'll like the compression at the front because compressing the front helps open the back. And then I have a very specific one. If you have to get treated because your pelvis gets twisted, there's a correction that you can do on one side, which really helps connect the tailbone to the hip bone at the front. So having a little play with those is super important. I highly recommend using them when you are doing any housework, when you are sitting for long periods. If you're traveling a long way in a car, I used to get my friend to do it if I was going to be on a plane for 24 hours because I knew I'd have to sleep and I'd end up in some wonky position and my body wasn't yet stable enough to survive that. Now I don't need to do them, so I use the tape as a tool initially to help me find the right positions. Then doing the detailed stability work has helped me not need the tape long term. So we need to reduce it over time. And then of course, once we've got that window, we need to build dynamic stability. I mentioned these little tucks and tilts sequences earlier, super important for getting the really subtle deep control of our spine. The 6D breathing with collecting the center is fantastic. And then my adult crawling sequence goes from very basic through to very advanced to try and develop really dynamic control of the spine. So we're not splinting it and holding it in place, but we're learning how to control it actually whilst we're moving. I've been very busy lately trying to reorganize everything to make things easier to find. So all of those videos that I've referenced are on the YouTube channel. They're now nicely organized in little stripes. All the pink ones are point, all of the reddy ones are about foot injuries, all of the taping techniques are green, so you can easily find your way around. There's also heaps of information on the Ballet Blog. I think we worked out, I've been writing and publishing things online for about 15 years, so there's a stack of information there, especially in regards to hypermobility. Keep your questions coming in because we will probably be doing some others, and I'm aiming to do a free hypermobility hacks course so that we can help everyone, because it's very frustrating. I know personally trying to deal with that amount of pain. So, oh, ta-da, work like magic. Don't know where that one was from. So I'll probably pass back to Linda to add in some comments. I'm sorry, we're just about at the end of our hour, but hopefully there's lots of helpful information in there for all of you hypermobile bodies out there.
All right. Well, we have some great questions and comments. And Lisa, you are such a wealth of information. This is so wonderful. And we got lots of great comments about when you were doing the wrist exercises, particularly. There were people that said, ta-da, brilliant, works like magic. So people really loved that. There was a question about the taping and at what age is it appropriate to start taping? And I would like to know, in your experience, how long do you generally have people do the taping for before they really don't need to do that anymore?
Yeah. Obviously in the clinic, I was having super teeny ones. I often teach the parents how to do the taping technique. So I had 4.5-year-olds that I'd teach the parents how to do it if they were super gamby. So as long as there's no skin irritation, I often do a skin test first by cutting a little square of the tape, and I usually put it on the inside of their forearm while we were doing everything else, and then I'd take it off. If there was a red square, it usually mean their skin wasn't going to like the tape. So we always need to make sure that we take care of the skin health. With any of the taping, if there's any irritation or itchiness, we need to take it off straight away. If that's all fine, the dynamic tape, people say to leave the tape on for 4 or 5 days. I find that most of us are a little bit too active for that. 2 days is usually about the max that I have it on, and I recommend having it on for 2 days and then off for 1. Then on for 2 days and then off for 1, as we're building up the stability underneath. How long they need to use it for completely depends on how good they are with their rehab. So if they're not doing any rehab, you're going to need to keep taping. But I've had some students that are phenomenal, and within 6 weeks, they're pain-free. Had one girl in particular, it was devastating. She was 14. She'd been told by the sports physician that she was excessively hypermobile and that she was going to be in pain for the rest of her life and she shouldn't do any physical exercise. I just about punched a hole through the wall when she told me this. But in the first session, I ended up just dynamic taping her together. And this little tear started rolling down her cheek. I said, honey, are you okay? And she said, yeah, I don't have any pain. I said, yes, that's what you'll feel like when your joints are stable again. It's going to take time. Within 6 weeks, she walked in and she said, Lisa, I don't have any pain. And this is a kid who at 14 had been given a life sentence of you're going to be in pain forever. So, but she was so good at doing everything that I told her. And we just did one kind of section at a time. Each time she came in, she had mastered the previous section. So we built on it, and then we built on it, and then we built on it. But had I had that same body with a kid who wouldn't do anything, she would be months down the track before we could wean her off the taping. And we would film the taping techniques. And so as she was getting back to things, sometimes then she'd start to feel a little bit uncomfortable. She'd just pop the taping on, go back to that section of stabilizers. So I really try and empower them to know how they can do it themselves. Like, honey, I can't hold you together. I can do it temporarily with tape, but you're going to need to manage this for the rest of your life. And this is why, especially in the area of hypermobility, I want to get this information out into the community, because there are so many people dealing with pain that really don't need to be in pain. And that's the thing that kills me. So hence why we're doing this.
Right. Absolutely. Absolutely. And in terms of, somebody asked a question that I definitely want to have you answer. If you don't mind, really quickly, it is it's Thursday where you are. How's Thursday looking?
Fantastic.
It's 7 o'clock here in Wisconsin. So last question before we depart here. I would love to hear you answer this one, because I know you talk a lot about joint popping, and somebody asked about thoughts on hypermobile patients with neck pain with a bad habit of popping. I think that's a good one to close on.
Yeah. So I have actually had this in clinic. I had it happens with hips and necks. I had one girl, and I asked my question that I ask is, how many times a day do you crack XYZ? I don't ask do they crack, I ask how many times a day. If I say do you crack, they say, oh, maybe a little. If I ask how many times a week, they'll say once or twice. If I ask how many times a day, they'll usually say once or twice. This one girl cracked her hip 27 times in an hour session. Ooh. So they don't realize how often they're doing it. And especially for necks, especially when the Justin Bieber hair thing came out, I had one young boy who came in with neck pain, and every 30 seconds, he was swishing his hair out of the way, had this horrendous neck, because every time he swished his neck, he'd get this click. So repeated clicking of the same joint will cause further instability. This is really important to remember as well if you're having any chiropractic or adjusting treatment. If they are cracking the joint that you can crack yourself, it's not usually a good idea. So if you are trying to crack yourself, you'll go at the most unstable segment. If you're getting treated for it, the therapist should be looking at the stuck points that are above and below it. So if they whip your head around and get the crack that you get every morning, you'll actually be making that joint more and more unstable. If they are stabilizing that one and helping you get mobility in the ones above or below it, then long term you won't need to crack that hypermobile one as much. So I hope that makes sense. Yeah, we definitely don't want to consistently manip the same joint. Every time we get that crack, that ligament is having a little bit of an extra stretch, and it comes more and more and more sloppy. It feels great in the beginning. Believe me, I know the joy of cracking a joint that's felt like it's been stuck. However, now I treat any need to crack as a sign of instability. Mm-hmm. I usually try and find a mobilizer that gives the same level of relief, but without the cracking, popping sensation. Depending on the joint, depends what you do. The other day in the teacher training course we did it, there's a nice little neck mobilizer. If you just use the flats of your fingers coming down to just above your collarbone, so in on your scalenes or your SCM if you know your anatomy, and if you just stabilize with the flats of your fingers and then really gently lean off to the side, with this really lovely kind of deep stretch, which will really help your neck feel free without cracking it. So I'll often do fascial mobilizers or hands-on techniques to release that feeling of need to crack. And then I follow it immediately with a stabilizing exercise. So when my back was really bad, I found that the QL side stretch and a hip flexor mob would clear it. And then I'd jump down and do the tucky tilty sequence because I knew I needed to make it stronger. So we need to avoid the crack, find a mobilizer that gives some kind of relief, and then a stabilizer. Will I say that I don't ever crack my back? No, I probably crack it once every 3 months now, usually after sitting on a plane for 34 hours. So it's not that it never happens, but it means that there's a sign of instability and you need to do some work on it.
And there's a big difference between a spontaneous crack or something that happens with a, movement. You're not forcing it to do that too, right? So
yeah.
If
it's cracking on its own, especially if it gets to the point where you're getting out of the car and your hip pops, that's an extreme instability. So usually it starts, you feel it and you give a little bit of a force. Yeah. Once you've been doing that long enough, you'll just turn to say hello to something and your neck will crack. That's when you know it's really unstable. Yeah.
Okay.
So you need to be very, very careful in that state. Yeah.
And there's so many people who say it's okay to crack your joints. So that's so important. Yeah. And I'm glad that you mentioned about, somebody asked a question about fascial release or myofascial release. And I do think that in certain circumstances, it's okay for people with connective tissue disorders, but people do have to be very, very careful because it can be overdone and things can be overstretched if you're seeing a therapist who's not super familiar.
Yeah. And also there's a great video if you're wanting to look into this in detail. Dr. Robert Schleip has a video. It's called Curious Here and Curious. It's from the International Fascial Research Congress. And he is a rolfer, and rolfing traditionally is really deep myofascial work. But he talks about how he treats has changed with the change in the research on fascia. So in the old days, old school myofascial release was really deep, really painful. If somebody is still doing that, they're probably not up with the latest research. What we've discovered now is that 70% of the kind of proprioceptors are in the top 20% of tissues. You can do super gentle floaty work on the surface and have an extremely profound release, much deeper, because of the interconnectedness. So if they're still doing hardcore myofascial work, I would be looking for somebody who's been doing some research over the last 20 years. 20 years ago, that's what we did. That's what we thought was needed, because we were taught that fascia was inert. It was really kind of rigid. Now that we have the tech to actually look at what fascia is doing live, we can see how moldable and transformative it is. So our treatment techniques have to change as we learn more and more about this. If you find somebody's really good with working with fascia, the girls call it my white witch techniques, because it feels like you're hardly doing anything, and then they stand up and their arabesque is up here. So it's about being able to tune into it and really subtly work with it, rather than forcing it to do something that it's protecting and trying to hold you together.
Wonderful. And if you would be able to send me a link to that, then I can share it on the feed on the event, and a few places, so that people will know what that is. So fabulous. Well, thank you so much for doing this, and thank you so much to everybody for asking great questions. And if you asked your question and we did not get to it today, we will, yeah, no problem. We have lots and lots more material, so we can definitely chat again. So thank you so much, everybody, for tuning in. It was great to see everybody. Really appreciate all the great questions. And thank you so much, Lisa, for doing this this morning.
Wonderful, my pleasure. Thank you everyone so much for coming on, and thank you for Linda for organizing it. And yes, I'm sure we can do it again. It's great to try and get some information out into the community, so everyone can be happier and healthier.
Yes, absolutely. Absolutely. Wonderful. Well, great to see everybody, and take care, and thank you again.
Talk to you soon.
Okay. Bye-bye.